Did you know that your skin, nails, and even your breath can give you important clues about your kidney health? Kidney disease is something I see every day, and we really experience it in the hospital. It's more common than you think and often hides right in front of our eyes. In fact, it's estimated that up to 90% of people with chronic kidney disease don't even know they have it. This is a big problem because if we can detect kidney disease early, we can usually treat the underlying cause and prevent further damage. So today I want to share 17 of the most important symptoms of chronic kidney disease with you, symptoms that could save your kidneys and your life. These two bean-shaped organs are located on either side of your lower back, just below your ribs. Now, most people know the kidneys as filters, and that's true. They filter out toxins and get rid of them through urine. But there's a lot more they do beyond just that. They help regulate the levels of salt, potassium, and other electrolytes. They even control your hemoglobin levels and help maintain the health of your bones. So the question is, how can you tell if these delicate and complex organs are having problems? Let's start with foamy urine. I don't mean just a few bubbles that disappear in a few seconds. I'm talking about a real layer of thick white foam that lingers, kind of like what you might see on top of a beer. This is a sign that a protein from your blood called albumin is leaking into your urine. And to understand how it passes through the filter and what it means for your kidneys, let's take a closer look. The kidneys have something called glomeruli. Just consider one of about a million tiny filters that make up each of your kidneys. It's a small cluster of blood vessels so narrow that red blood cells have to pass through them one by one. But we need to look even closer. Notice something that looks like tiny hairs on the surface of the blood vessel. These are actually tiny projections that extend from specialized cells called podocytes, creating a living filter. But the podocytes become flattened, which leads to the opening of gaps in the filter that allow proteins like albumin to leak through, and this can easily go unnoticed. But fortunately, albumin has a structure similar to soap, which is why it creates this thick foam. In fact, this is a bottle of albumin that we use in the hospital, and you can really see how foamy it gets. Alright, now let's do a quick experiment together. This is something I do for almost every patient in the hospital. Pull up your pant leg and then gently press your thumb on your shin bone for 5 seconds. Then check to see if there's a dent left behind or not. If there is a dent, it's called non-pitting edema, and the reason for this is related to foamy urine. When albumin is lost through urine, your blood albumin levels drop. And albumin plays an important role in keeping fluid inside your blood vessels through osmosis. So without enough albumin, fluid starts to leak into your tissues and causes swelling, especially in the lower areas and on your back above your buttocks. And this free fluid usually follows gravity, which is why most people notice swelling in their feet and ankles, although it can also accumulate in loose tissues, like around your eyes. But here's the problem. Even though you're swollen, in reality, there's less fluid circulating inside your blood vessels, and your kidneys interpret this as your body being dehydrated. So to help your kidneys retain salt and water, which only makes the swelling worse, creating a vicious cycle. In severe cases, this fluid can even enter the lungs and make breathing difficult. But before you panic, there are many reasons why your feet might swell. A small amount of swelling, even after standing all day, can be normal, but it should usually get better at night when you lie down. If the swelling in your feet doesn't improve, or if it's getting worse around your eyes, it could be related to your kidneys and should be checked. Alright, now let's talk about a common misconception. I've noticed that most people think if they urinate a lot, their kidneys must be healthy and working well. But when it comes to your kidneys, quality is more important than quantity. In fact, the first thing that stops working properly when your kidneys have problems is their ability to concentrate urine. And this is most noticeable at night. Normally, your kidneys produce concentrated urine at night, partly because you're not eating or drinking, but also due to a hormone called ADH. So if you have to wake up several times at night to go to the bathroom, we call that nocturia. That means it's one of the important symptoms of kidney disease. Now, take a look at your nails, especially their color. Seeing two colors, especially on the thumb, is normal. The lighter part at the base of the nail is called the lunula, which means little moon, and you can think of it as the part of the nail that is still being formed. Now, compare this with the nails of a patient with chronic kidney disease. They also have two different colors, but don't be fooled. This isn't a normal lunula, and the other half of the nail is a reddish brown color. These are called half and half nails. Not everyone with chronic kidney disease will have nails like this. And in fact, we don't really know why this happens, but there is a very clear connection between those nails and kidney disease. Now, let me turn your attention to phosphate. It's a mineral that your body regulates very strictly, and when its levels rise, it can cause major problems. We mainly get phosphate from our food. In fact, most of us get too much phosphate in our diets, but healthy kidneys can easily handle it. However, when your kidneys are damaged, they can no longer get rid of that excess phosphate and its level in your blood rises. And the reason this is so important is that phosphate binds to calcium and forms calcium phosphate crystals. And depending on where they deposit in the body, they can cause a whole range of harmful symptoms. When those crystals deposit in the skin, it's called cutaneous calcification. It usually appears as whitish yellow bumps that are hard under the skin and not painful. Sometimes they can open up, and what comes out is a thick paste of calcium phosphate that reminds me of toothpaste. In addition to kidney disease, you can also see this symptom in other autoimmune diseases like scleroderma or dermatomyositis. Although these can be very bad for patients, in a way it's the best case scenario because those same calcium phosphate crystals can also deposit inside blood vessels, which can lead to a medical emergency called calciphylaxis. In those cases, the blood vessels become blocked, organs and tissues don't receive enough oxygen, and in severe cases, it can be fatal. But there's also a subtler way that high phosphate can affect your blood vessels. Take a look at this X-ray. Yes, I know he's lost part of his finger. We'll leave that to the orthopedist. What I want you to focus on are his arteries. You're not supposed to be able to see them this clearly on an X-ray. So what's going on? Normally, your arteries have smooth muscle cells that can contract and relax to control the flow and pressure within the blood vessel. But when they're flooded with phosphate, these cells go through a complete identity crisis. In fact, they start behaving like bone cells and deposit calcium phosphate in the walls of the arteries. So the arterial wall, which is usually elastic, becomes as hard as bone, and you can actually feel it under the skin. The best way we can describe it is that it feels like a guitar string under the skin. So clearly, high phosphate levels are a big problem, and part of the way your body tries to manage it is with a hormone called FGF23. This hormone tells your kidneys to get rid of phosphate in your urine, and it also tells your intestines not to absorb too much phosphate and calcium. It does this by preventing vitamin D from being converted into its active form. Eventually, your calcium levels start to drop, and this can lead to painful muscle cramps, especially at night. When you're trying to sleep, although low calcium isn't the only culprit here. In the early stages of kidney disease, you might also have low magnesium, or you could have too much acidity in your blood, all of which can lead to muscle cramps. So if you're experiencing unexplained muscle cramps and you haven't just started a new exercise routine, it's worth checking your kidney function and your electrolyte levels. All right, let's turn our attention back to calcium. When your calcium levels are low, your body releases parathyroid hormone, which tells your cells to start breaking down your bones to release calcium into your bloodstream. This is a great temporary solution, but over time you can imagine that you're just solving one problem while creating another. This leads to weak and brittle bones that are prone to fractures, which we call osteoporosis. An important sign of osteoporosis that I pay attention to is a decrease in height. So when a patient tells me they've gotten a few centimeters shorter than before, that's really a red flag. Of course, bone fractures are also common in these people, especially after falling from a height. In areas like the wrist, spine, or hip, but beyond electrolytes, there are a whole bunch of toxins that start to accumulate in the blood when the kidneys begin to have problems. We call this uremia, which is a nicer way of saying urine in the blood. And the very first symptoms can really affect your sleep. An unrelenting itch all over the body, which usually gets worse at night, can sometimes be the first sign of kidney disease. That's exactly what happened to this 57-year-old man. After scratching his skin raw from the itching, he went to the doctor and a blood test showed that he had advanced kidney disease. Several things can cause this. Uremic toxins can accumulate in the skin and cause irritation, and those toxins can also activate an itch receptor called part 2, which can make the ends of your nerves extremely sensitive. Even worse, it can eventually reach the brain and chronically activate your itch circuits, leaving you feeling itchy all the time. Now, restless leg syndrome is also a terrible and distressing condition that causes an overwhelming urge to move your legs, and the symptoms are usually at their worst when you're lying still at night trying to fall asleep. The main theory is that when your brain is low on iron, it can't produce enough dopamine, which leads to this irresistible urge to move. But what does this have to do with your kidneys? Well, uremic toxins increase inflammation, which leads to the production of hepcidin, a hormone designed to protect your body against bacteria. This is how bacteria that grow by consuming iron operate. During an infection, hepcidin sequesters your body's iron and stores it away, and also prevents you from absorbing extra iron from your food. This helps starve the bacteria while your immune system goes and kills them directly. But here's the problem. As your kidney function worsens and toxins build up, your hepcidin levels rise inappropriately. So even when your body doesn't have an infection, it's chronically deprived of iron, and that's what leads to restless leg syndrome. So all of this is to say that if you're having trouble sleeping for any reason, it's worth taking a look at your kidney function as well. The buildup of toxins can also affect your sense of taste and your appetite. If you like this kind of information and want to support my channel, or if you have a question you'd like me to answer during my monthly live stream, click on the membership or join link. This is specifically for people outside the country, and with a small fee I can do this. Imagine you're about to take a bite of your favorite food, and then you realize it just tastes like metal. So a metallic taste is a very common complaint in kidney disease. When urea builds up in your blood, some of it gets into your saliva. There, the normal bacteria in your mouth break down the urea into ammonia and other compounds, and these byproducts stimulate certain receptors on your tongue that most people experience as a metallic taste. And unfortunately, these compounds can also make your breath smell a bit like urine, which we call uremic fetor. So when your breath smells like urine and your food tastes like coins, it's no wonder that many people with kidney disease lose their appetite. But believe it or not, it gets even worse. Uremic toxins directly affect the brain by activating receptors that are normally used to detect food poisoning. This area is called the chemoreceptor trigger zone. It doesn't have a blood-brain barrier, so it can detect toxins quickly and accurately. When it senses a toxin, it tells your body to stop eating and to vomit in order to protect you. This is an excellent defense mechanism, but not if you have kidney disease. Unfortunately, uremic toxins can also activate this sensor in the brain, leading to loss of appetite, nausea, vomiting, and over time, unwanted weight loss. The next issue is easy bruising. One person said her husband is always bumping his leg against the side of the bed and barely gets a bruise. But on the other hand, patients with kidney disease develop huge bruises and often have no idea how they happened. Normally, when you get a cut or injury, tiny blood cells called platelets rush to the damaged blood vessels and stick together to form a plug. This is the body's natural band-aid, but in kidney disease, uremic toxins make your platelets less sticky. So stopping bleeding in these cases is more difficult. Some symptoms you might notice are that your gums bleed more easily when brushing your teeth, you have more frequent nosebleeds, or you just have more bruises on your skin. Now, this is a 39-year-old man with kidney failure who has missed several of his dialysis sessions. Look closely at his skin and you'll notice how it's covered with a thin white powder. This is actually a late finding called uremic frost. Basically, his sweat is so concentrated with urea and other toxins that when it dries, it leaves this thin white powder of crystals on his skin. Seeing this is rare, and if you do, it's a sign of advanced kidney failure. There's another late finding of uremia that I wanted to mention here. Uremic toxins can cause chronic inflammation of the pericardium, which is a thin sac surrounding the heart, And when it becomes inflamed, we call it pericarditis. But unlike having an inflamed knee, you can't just rest your heart to make it better. The heart keeps beating and rubs against this inflamed tissue, which causes a lot of pain. And when you listen to it with a stethoscope, you can hear a scratchy sound that's being produced quite aggressively. In fact, it's the sound of the inflamed tissue moving with the beating of the heart. All right, let's get back to the common symptoms. I think the thing patients mention to me most often is fatigue. There are many things we've already talked about that can contribute to feeling tired when you have chronic kidney disease. Poor sleep caused by muscle cramps, itchy skin, and restless leg syndrome, changes in electrolytes, and the buildup of uremic toxins. But there's another important reason as well, one that's not very hard to treat but often gets overlooked. Your kidneys are responsible for producing a hormone called erythropoietin, which tells your bone marrow to make more red blood cells. Yes, the same EPO that Lance Armstrong admitted to using to increase his red blood cells and boost his performance. But if high levels of EPO can help you win the Tour de France, then low levels in chronic kidney disease can make it impossible to even climb a single step. However, thanks to injectable synthetic EPO, we can actually reverse many cases of anemia caused by chronic kidney disease. And the last symptom that needs to be explained and mentioned is actually no symptom at all. We divide chronic kidney disease into 5 stages, with stage 1 being the mildest and stage 5 the most severe, which is often when dialysis is started. The truth is that many people don't notice any symptoms until they reach stage 3. And if it's detected earlier, it's usually by chance through a blood or urine test. So prevention is key. There are many reasons why your kidneys can develop problems, which I have discussed in other videos. You can see them on the screen. Click on them to see if they help inform you. Thank you for staying with me until the end of the video. Until the next video, take care.